Hi, my name is Leda McDaniel. I am a current orthopedic physical therapy resident at Emory University School of Medicine. And today I would like to discuss a case study report on an individual post-hamstring strain and the repercussions or the factors influencing this patient's care associated with the COVID-19 pandemic and adjustments in care from that pandemic. So background and purpose for this case study, due to the COVID-19 pandemic and healthcare precautions, there have been a number of changes to physical therapy care. Some of these changes include delays in access to care, telehealth provision of services, whether synchronous or asynchronous, and limited access to equipment, whether a patient is exercising in their home and has some equipment at home or maybe not any equipment at all, or the patient has limited gym access. This has impacted the provision of physical therapy services. A little bit of background on hamstring strain injury. So we know that hamstring strains have a high rate of re-injury and recurrence. Up to a third of these hamstring strains, individuals with hamstring strain will re-injure within the first year, and up to 48% of individuals will experience a re-injury after a hamstring strain. Treatments for hamstring strain typically involve staged rehabilitation approach where patients are progressed through criterion or time-based stages, eccentrics, core, and agility training. So a clinical question for me was, how do COVID-19 factors impact physical therapy care and outcomes for a patient recovering from a hamstring strain injury? The patient that I was working with was a 20-year-old male, was a college sophomore, and he presented to physical therapy with complaints of right posterior thigh pain. He had been diagnosed by a physician with a grade 2 hamstring strain. He was injured in a recreational basketball game in the middle of February, but didn't present until 14 weeks after injury to physical therapy due to moving home from college because of this COVID-19 outbreak. And these are the factors that impacted this individual's care. So because he had delayed initiation of care, I elected to utilize a criterion-based progression versus a time-based progression. He was already 14 weeks out of injury, but he still had significant pain and functional deficits. We delivered physical therapy via telehealth. So all our treatment sessions were delivered via synchronous video platform, HIPAA-compliant video platform. And thus we were limited in what we could deliver. So there were no hands-on treatment or assessment techniques, but we did do a lot of patient education and therapeutic exercise. With limited access to equipment, but still we're able to do quite a bit with body weight loading, eccentric exercises as pictured here, long leg exercises, some core agility training, and early walk, run, return to run progression. So outcomes for this individual, I'm still treating this individual, so some of these are limited, but within 3 weeks of physical therapy care, he did have quite a bit of improvement. So improved function. Initially, squatting to a quarter depth was painful. So by that third week, we had him squatting with a 20 pounds of weight. He did have access to some weights in his home, and he was squatting to full depth with no pain. So that was great. He was initially walking up hills was painful, and we progressed him to the point where he was able to walk on flat and hills up to 45 minutes, no pain. So his pain decreased. Early return to sport activities included some light shooting and some light dynamic warm-ups, and we were able to get him there by 3 weeks. And he had no re-injury or adverse events with this progression. Study limitations are generalizability. So type of injury here was hamstring strain, but it remains to be seen whether these methods could be applied to other musculoskeletal injuries. For telehealth, there's limited access to technology or tech literacy for some individuals, and that may be a barrier to delivery. And then equipment, as we mentioned, and a limited follow-up. So the patient is still receiving physical therapy treatment. Some clinical takeaways. So slower return to sport if physical therapy is delayed. We saw that this individual at 3 weeks was still not able to return to full sport, though we were incorporating some sport-specific activities. And Also, we found that overall, physical therapy was effective for this individual. Through the course that we were treating, we were able to see functional improvements and early return to some sport-specific training and return to run, despite these changes in healthcare delivery. So it's really promising what we are able to do, even given these changes. I want to thank Brooks Institute of Higher Learning and my residency mentor, Dr. Kathleen Geist, for her continued support and mentorship. Thank you.